Assalamualaikum and a very good morning. So I know we are a bit tight with regards to time, so I'm going to try to keep to time as best as possible. So this is where I work, and I like to think we do a bit of regional anesthesia. You could see my staff nurse Hasniza is there in the picture. So Dr. Ng is, I think, doing an ESP block. Okay, nothing to disclose with regards to this particular talk. Okay, I'm just going to, since we're talking about satisfaction, this is just to highlight, this is an article I co-wrote. So we had this super morbidly obese BMI of 60 with a very, very large fibroid. And this is, at the end of the day, of course, the photos were taken with permission, we published this. The patient looks happy. And in the description there shows patient is comfortable at 6 hours after surgery in high dependency unit. Patient's diet slowly advanced. Basically the patients assume oral intake quickly within a few hours and was able to take a full oral full diet at about 12 hours and was discharged within 24 hours. So it is kind of an enhanced recovery because it was minimally invasive, and we provided our anesthesia to enhance the patient's recovery. So this is where what is actually patient satisfaction? Okay, there's quite a bit of definition there. It's a bit of a touchy-feely subject, and this is the first time I'm actually talking about patient satisfaction because it's much easier to talk on when there is actually hard evidence. How do you do this particular block? Is this block successful or not? So I'm just going to quote this particular journal. So basic patient satisfaction is dependent on the patient's expectations with the provider and or type of service, and it's highly subjective. So basically what is important is that the patient's expectation is also important. So this is what I will highlight in the next few slides, because if the patient has low expectations, then it's much easier to make the patient satisfied. But the patient is, has very high expectations, they want pain-free, I'm going to be wide awake, no nausea, vomiting, I'm going to jump out of my bed after the surgery. So then there's a lot more things that you have to do to make the patient satisfied. So why do we do it? I mean, for most of you who know, this is the Simon Sinek's the Golden Circle, when we, where he talks about organizational motivation and so on and so forth. But it's important to find out why that we're doing this. Why is patient satisfaction important? So I'm just going to quote this particular article by Andrea Eisenberg, because when patients are satisfied, it can lead to patient loyalty. So the patients, of course, in the sense of private practice, we want the patients to come back to us and not go to another rival hospital. Better clinical outcomes, patient compliance, and fewer medical malpractice. I think for most of us who are paying quite a large amount for our indemnity insurance, we don't want to avail to that insurance. We want to so that our premium does not go up. So something that we need to consider is that patients will not tend to sue if they are happy with ours, if they're satisfied. Then I will show you that probably in terms of whether satisfaction is related to, for example, pain or outcomes. So this is, let's zoom into regional anesthesia. So this is myself doing, I think it's a central Gleneagles block. So one of the first studies on patient satisfaction for regional anesthesia was this particular one. It's probably not so long time back. It's published in RAPM in 2014. So they were looking at this Aurora. I think was part of this registry, Aurora, International Registry of Regional Anesthesia. So they were looking, they had about nearly 10,000 surgical procedures where they sent this survey, and they had a 60-odd survey response. They have a lot of, I would say, questions, but I'm just going to highlight the conclusion. One of the important ones, the high proportion of survey respondents were willing to undergo repeat PNB in case of future surgery and were satisfied with the anesthetic care. So at least in this particular registry, patients were willing to undergo PNB again if there is a need to. But if you look at what they actually asked, apart from that one particular, whether they're willing to actually undergo peripheral nerve block, again, is that they have this information domain. So there's a lot of things, like, I won't go into great detail in the interest of time, but for example, question 1, to what degree were you satisfied about the explanation of the RA procedure? And question 8, to what degree did your anesthesiologist show understanding for your situation? So this is information domain, and there's also this domain with regards to pain and discomfort domain. So for example, question 3, to what degree did you have pain or discomfort during the nerve block procedure? And question 7, when the numbness or heaviness from the nerve block wore off, how much pain do you experience? I mean, this is relating to rebound pain. So, but if you look at this, even all the questions, most of the respondents, answered as satisfied and completely satisfied, and most of them have no issues with regards to pain and discomfort domain. Okay. Subsequently, there were this particular 2019 study done by the Dutch, and where they had about 243 patients, and they divided between GA and RA, and a third of the patients were not fully satisfied. So I said this is actually coming from a Western European model population. So, and if you could look at this, the ones that, if you could look at the data, the GA, most of them are fully satisfied or partly satisfied. So this is a Likert scale. They ask, fully, partially, or dissatisfied. And whereas there's a higher percentage of partly satisfied and dissatisfied, and this is clinically significant with regards to regional anesthesia. And these were why they were not fully satisfied, from insufficient, of course, when there's conversion from RA to GA, then, or when there's a need to give heavy sedation, then most patients are not going to be satisfied. There's also this pain discomfort with insensate and immobile limb. So something that we need to consider. Of course, you get this full-on 0 pain score, but but they can't move their limb, and this can lead to dissatisfaction as well. And it goes down the list. But looking at this was 2021 published in IJA, Indian Journal of Anaesthesiology, and they were looking at patients. There were 100 odd for each arm, RA and GA, but they found out that the patients in this Indian population were highly satisfied with their RA compared to their GA. Okay, but look at what they asked. They were asking all this, things like soft skills, communication, kindness, regards of caregivers. So they score from not kind to very kind, feeling safe, feeling relaxed, from not kind from not safe to feeling safe, not relaxed. So it's more like a touchy-feely kind of, rather than the block work. Is there a need to convert for GA or high sedation and so on and so forth. So and again, with with regional anesthesia, there's actually a high, definitely compared to general anesthesia, and all these variables were statistically significant with regards to RA. So patients were more satisfied when you ask them. But so the authors were trying to explain how did this happen and things like that. But in this particular series, the patients were not sedated. And of course, there's a lot of interaction. So I guess there's a lot more communication between the regional anesthesiologist and the patient, because they're kind of wide awake. So I think communication plays a role. What I'm trying to say, that you need to talk to your patients before, during, or after and when there's significant communication, there's meaningful communication, then most patients will tend to be satisfied. This is another one, 2024, very recently in anesthesia and analgesia, but this was in Tanzania. There were, of course, it was more like a case series, 170 patients, and they were kind of asking whether the patients ultrasound guided RA in this resource limited environment was satisfied or not. But based on the study, the patients were very satisfied, and this is what they asked from whether information was given, interaction with anesthetist, and the nerve block cell. So even in this particular series, there's a lot of this domain about soft skills, communication, and information, whether it was shared, and so on and so forth. Okay, so this is actually a picture when I took from the Gleneagles website. This is under anesthesia. So we are kind of always portrayed as doctors who behind the screen with the mask on, and the patients get knocked out. Okay, and when you look at this is endocrinologist, the patients, the doctors talk to the patient, and they're good looking and whatnot. So this is something that we need to consider, because I think to increase our patient satisfactions, we need to talk to the patients quite a lot. And if we zoom out, okay, when you talk about perioperative satisfaction, this is a validation study by BJ, and subsequently most of the studies with regards to perioperative satisfaction uses this Leiden which is a city in Netherlands, perioperative care, patient satisfaction questionnaire. And if you could look at, I know it's too small, if you look at all these stress tests, things like the amount of explanation about surgery, did the staff of operating theatres take into account your privacy? So there's a lot of soft skills involved. And just to quote this particular, just to kind of highlight one study that used the LPPSQ, this is in the Netherlands. So they say that the patients were satisfied with the provision of information regarding regional anesthesia. So a lot of these studies were looking into actually the communication between anesthetists, regional anesthetists, and the patients. So I'm just going to quote this. This is kind of interesting. Defining success in RA. It's a review article published in Anesthesia in 2021, and it has all these pillars. One important one, of course, is patient. So why is important? Is we can look at things like communication and what I have quoted earlier on. I'm just going to highlight that it's actually a bit of a disconnect between, this is to highlight this particular publication in 2016 in the UK, where the investigators were looking at whether the patients, a large series, about nearly 10,000, more than 10,000 patients, where they were looking at anesthesia-related discomfort from thirst, drowsiness, and so on. There's about 35% of patients who do complain of all this anesthesia-related discomfort. But if you look at whether they are dissatisfied or very dissatisfied, it's actually about 5%. So there's this disconnect, meaning that they may experience a lot of discomfort, but because of the expectations were met, then they do not complain, or they do not complain of low satisfaction. And things that we can do, for example, this is a bit dated, 1995, but for example, when you're doing the block, at least give a bit of local anesthetic. So one of the things that the patients pointed out, that the analysis showed that the complaint of needle puncture to be the greatest negative factor. So when you're doing particularly without any sedation, and then try to give a local anesthetic with the smallest needle possible prior to your block needles going in. This particular one seems to suggest that it's best probably to give some degree of sedation. Like, for example, in my hospital, we do quite a bit of TIVA, so most of the time we'll be running a bit of propofol and fentanyl when we're doing all these blocks. And finally, I think it's about function. When we do this regional anesthesia, we need to think of the function post-op. This particular study did not mention so much about regional anesthesia, but what I'm saying is that when we do nerve blocks for our major arthroplasties, we need to consider, can the patient move immediately? Can the patient move as soon as possible? And in the era of eras, we want the patient to be jumping out of the bed immediately. So for example, we have one particular surgeon who, if they operate in the morning, the patients will be standing up on the same day in the afternoon. So something that we need to consider when we're doing this, and the communication, how we do the blocks, and what the post-op outcomes, particularly with regards to motor sparing, is very important. If I can kind of wrap it up, I think it's important when we consider how to ensure high patient satisfaction is we do to the patient how we wanted, how we want. For example, if you are a patient self, I know this because I was a patient once in one particular hospital, and undergoing a procedure, and the sedation was very substandard. So right now, when I do cases myself, I know that sedation is very important. Of course, not giving too much sedation. So it's important when we are providing care to the patient, we need to imagine ourselves, as patients. So things like, if I can finally conclude, communication, and do unto others how you want others to do unto you. Thank you very much.